Welcome to 24 Cares. I'm Devin Owens-Toller, Leader of Operations and Analytics.
And I'm Annalise Alamo, Culture Transformation Leader.
We're Cares by KJE. We are a tech-enabled strategy and leadership development firm specializing in diversity, equity, and inclusion. Today, we are continuing the conversation with Leonor Marquez, CEO of Los Berrios Unidos Community Clinic. Welcome back, Leonor.
Thank you.
Happy to have you back.
Thank you. Good to be here.
Great. Well, we've been having a great conversation about LBU and the impact to the community. We talked about all sorts of things, education, how we take care of patients and all of that, and how that's translating. We touched a little bit, I think in our first episode, about policies and inequities and potential inequities in the healthcare policy in particular. I know this is a topic near and dear to some close family members who are approaching that age where they have to consider like Medicare and different options and paying for insurance that may be costly, and what does it cover, what does it not cover. So all things related to healthcare policies. How do you feel about where we are today in healthcare inequity or equity? Is our system an ally or foe, especially when it comes to multicultural positions?
Oh, Annalise, that's such a good question. Ally or foe, it's hard to think of it as absolute. So I guess I can illustrate it with a couple of examples. I mean, we are fortunate to live in the United States of America, and arguably the best healthcare in the world. We are a few miles from one of the best medical schools in the world. Yes. We should be very proud of that. Down the street, literally down the street, we've got the best access to the best healthcare. Now, but does that translate into true access? Can the average person get in there? Can just anyone get in there? Would people of any stripe have true access to that magnificent healthcare? In this country, it's a fee-for-service world, meaning the healthcare team, the clinic, the doctor provides a service and gets reimbursed. That reimbursement is either cash, but more than likely it is insurance, right? That's how it works. You get really good healthcare because you've got an insurance card in your wallet. And you have that insurance card because you have the kind of job that provides healthcare. And it's you may have a copay, but for the most part, the insurance premiums are, again, the American way, have largely paid by your employer, not 100%. So those are all policy driven. Okay, that's just the way things have evolved in the last 100 years in this country. So where does that leave the person that doesn't have health insurance, that doesn't have the kind of job that provides health insurance, or that health insurance is so cost prohibitive? What about the startup? What about the millions and millions and millions of jobs that are created by startups, by small businesses, by entrepreneurs, that the employer or the person can't afford $1,200 or whatever it costs to provide health insurance? Those are all policy driven, so not great. The good thing is, because what's also available in this country is a safety net. Clinics that offer care on a sliding fee scale, or hospitals, but there are not enough of those, and those tend to be available in cities, and in frontier spaces not so much, in rural places not as much. So again, all policy driven. So friend and foe, I guess.
Yeah. And I think it's the lens that you look at it too. I guess I've been blessed too to be exposed to different healthcare policies. I used to live in the Philippines. I used to also live in London, where I actually gave birth to my first daughter there. And everything was free.
Yes.
Right? Social health care and everything was free.
Right.
But quality of care, I don't know that I would do that again, right? And so it's really just a difference. And then you come from a country like the Philippines, where the policies are different. Like, you really have to have cash. If you even if you're having an emergency or need a surgery, you have to put a certain cash before they even see you, especially if you don't have insurance, right? So it's kind of extreme, I guess, in those worlds.
I also think of a very recent example. My brother and his family were in Italy for vacation. While they were there, I mean, this was just a couple of months ago, and while they were there, my niece, my 17-year-old niece, had severe abdominal pains. It turns out it was appendicitis. And that's something that has to be, you don't get on an airplane and fly back to the United States. You get that
Yes.
attended to, you get that taken care of.
Wow.
She got excellent care. She got, there was no issue. It was, why don't you speak Italian, and where are your papers? Or that was just a non-issue. Again, their policies, because what they said over and over again is, we're taking care of the patient. Here in Italy, we take care of the patients in not the order they came in, the order of acuity. Okay, so this person goes first, not because they have the best insurance or the most money or whatever, in an order of emergency. What is the more critical? And so she was kind of seen when she needed to be seen, and very good care, very attentive, different kind of setup in terms of, it didn't look exactly like our ERs or our operating, well, the ERs where they first came in, and she was kind of there for a couple of days. But throughout, or towards the end, as she's recovering, my brother says, okay, my brother is an engineer. He lives in California. He said, I have very good insurance. I'm happy to give you my insurance card. And I said, no, sir, that's not necessary. Thank you, but no, that's not necessary. They said, well, I can pay you, and then I'll deal with insurance when I get back to the United States. And they said, well, no, sir, it's okay. They were being polite. They were. They were very polite in how they said that. But it was, well, no, we took care of you. You don't pay here. It's like in your country, it was very sweet the way they made the analogy. In your country, it's like paying the firefighters. You don't write a check to the fire department. You don't write. It's just part of living in this society.
Wow.
What a beautiful illustration.
That's an amazing illustration.
It was foreign speaking, foreigners.
Yeah.
They unexpected, able and willing to pay, but it was a non-issue. Yeah. What a different trajectory for that they had in that country. Very different than what immigrants face in this country.
For sure.
Yeah, no, that's a big deal.
Yes.
I mean, you're already stressed out because you're in a different country having to have health care, but to have that type of discussion, especially about financial stuff, is definitely a big relief in that situation.
Yes.
Yeah. So where do you feel like we are kind of continuing along that same vein? Where else are we kind of missing the mark, or where are we making a positive impact in terms of our healthcare policies in the United States?
Our healthcare policies, it's a complicated question and an extremely complicated answer. There's so much that has to do with our health that is not related to going to the doctor. Now, I'm a CEO of a healthcare organization. I'm all about going to see the doctor. But there's so much about your health that has to do with where you live, how you live, what you ingest, how you move, the toxins you take in or refrain from. All of that a lot of that is policy driven, right? Some of it is the insurance card that you have in your wallet, but a whole lot of it has to do with your education, the quality of education. Were you able to graduate from high school from a decent school? And even get a little bit of college, because that little bit of college, it gets you a little bit further in terms of critical thinking skills. Not everyone needs a degree. That's not the issue. That's just like, can you make decisions for yourself? Are you afforded the opportunities for a decent job?
Yeah.
I mean, all of those things, policy driven. Some things are getting better, and quite frankly, even though I'm in the going to the doctor business, improving health is about diet and exercise. A whole lot of it is diet and exercise, but where you live and the environment that we're exposed to.
Yeah, that's so good. And this whole conversation is making me think about, so I graduated from college like the third time a few years ago, but right at the start of the pandemic.
Oh my.
And I was obviously older than 26, so I wasn't on my parents' insurance anymore. I couldn't extend my college insurance anymore. And so I was in a place where I was unemployed because it was hard to find a job at that time. And I didn't have health care for a while.
Scary.
Yeah, so it was a very different experience, and it was a time of hoping, of course, that I didn't get COVID and have to go to the hospital, but hoping that nothing else happened where I had to be admitted or be seen for anything at all. So I definitely empathize and sympathize with communities that or people in general that don't have access to affordable health care, to, physicians and doctors that can care for them with cultural intelligence and emotional intelligence,
Well
and
put,
really,
yeah. So that's the life so many of our communities live in. Not having insurance and just hoping you don't get injured, hope
Yes.
you don't get sick, and
Yes.
hope you don't get COVID, and
Yes.
all of those things. And it reminded me that in the early days it was very scary. It was very scary for everyone. We weren't quite sure what we were dealing with, but we knew to isolate. We knew to that kind of thing. And before masks were, in the early days,
Yes.
right, when there weren't even enough masks to go around.
Yes.
And what's an N95 mask and those kinds of things. But in the early days, again, being culturally appropriate and sensitive, we had families come in, and some family member tested positive for COVID. And so what are the protocols? Isolate, don't go out anywhere, don't be in the same room, don't share a bed, all of those kinds of things. Use your own bathroom, use your, all those things. Well, that's really crazy to say that to a family that's, of course they share a bed,
Yeah.
2-3 people, like I shared a bed when I was a kid, okay?
Yep.
We didn't have our own bathroom. It's really presumptuous to think that little Susanna is going to have her own suite. So how can you mitigate that? How can you just say, well, no, just make it happen? No, there's a way to do that in a culturally appropriate way. Disinfect the bathroom before and after every use, those kinds of things. Plan how you take showers and timing and all that kind of thing. There's still a way to do it. Yeah. And again, quite presumptuous for us to say, just don't go to work. Don't go to work, it's too risky. It's like saying, don't feed your family.
Right. Yes, they have
don't
to
pay
work.
your rent.
Yes.
You're already kind of living paycheck to paycheck and not all that solid of a paycheck.
Yeah.
So it is again, culture just plays into everything we do.
Yeah. So health disparities are not limited to just race, right? There are also other demographics or dimensions, I guess, of diversity, such as gender expressions, the LGBTQIA community, and also physical disabilities. So how are the gaps being bridged for these communities in particular to receive proper health care without judgment or exclusion?
It's first of all, it's about being exposed to different cultures. And my goodness, if they're not coming through your doors, then read about it, get trained about it, see, and so we as an employer try to do our part. We engage you guys so that we can be a little more enlightened. And then just having a respect for differences, rather than I'm the doctor, this is what we do here, just really understanding where people are coming from. And it's not until you start having conversations and engage more people and quite frankly kind of mess up sometimes. It's like, oh yeah, I don't want to do that again. You kind of learn the hard way.
Yeah.
Like so many of our lessons, just learning the hard way.
Yeah.
But we do want to get smarter. We do want to learn, and quite frankly, part of LBU Community Clinic going into new markets is because there's need there. Okay, it's not just because we want to do more. We are in neighborhoods that need us there, that quite frankly have invited us in. It's not presumptuous to say, okay, we're going to go there because they need us. That's going to fail, quite frankly, if we do that. It's more like, okay, they have asked for a doctor they want a doctor that looks like them, they want a doctor that, or medical practice that is accepting of them. That's much more likely to work than just saying,
so
we know what to do.
Yeah, that's so good.
And the free of judgment thing can be a hard thing, especially outside of race or outside of culture. If there's other beliefs systems, obviously that's going to differ per healthcare provider, per patient, and all of that. So how do you work with grace without judgment, still providing care?
That's right.
So it's a balance.
It is.
This has been a great conversation, talking all things policy and inequities in healthcare. Thank you for tuning in to 24 Cares, where we help you live a 24/7 commitment to DEI 365 days of the year.